Hi everyone. Today we have a very exciting panel with us. We are discussing refractive surgery, the nuances, the advantages, disadvantages, complications, and the human side of doctors who are performing the surgery. So let me introduce first Dr. Tanvi, who is working at Lakshmi Eye Hospital, Dr. Shreya at Rishabh Eye Hospital, and none other than Dr. Rupal Shah, who is working at Center for Sight in Vadodara. She is fondly known as the Queen or the Mother of Smile in India. So welcome everybody.
Thank you.
Thank you.
Thank you. So let me just start by going through the pillars of Center for Sight. So Center for Sight is built on 3 pillars: talent, trust, and technology. So the idea is to have the best of talent amongst us, which is sitting right here, and ma'am is an example of that, and so are all of us. Then technology, we know that refractive surgery is a science where technology is very, very important. And it's a science heavily dependent on technology, and we know that technology is changing day by day, and so is the science. And we are joining on that bandwagon at different parts. And of course, trust that we built on the patients and how the patient who is thinking of refractive surgery is coming to us. So I want to start with you, ma'am. How was your journey coming onto refractive surgery?
So I was very young when I started doing refractive surgery. It was way back in 1994 when we first started our first laser refractive clinic in Mumbai. It was a time when there were very few laser centers all across the world. In India, there were only 2.
Wow.
And so it was a new technology. It was, we were very young. We were very inexperienced. We had dreams in our eyes and really thoughts of expanding to entire India. And with that, we started with no money. And it was a journey which was full of ups and downs, more downs initially than ups, but we survived. And it was a really exciting and interesting journey throughout.
I'm so surprised, and I would say I can't imagine putting myself in your shoes in that time when there was no YouTube, no internet, how you could have actually learned the surgery.
We almost lost our shoes.
But now, knowing that we are the next generation of refractive surgeons, so our training was a bit more different, right? We have YouTube, we have social media, we do have the videos, mentors like her. So it's possibly a bit easier, but I think it's a very difficult journey. And how was your journey when you came into refractive surgery?
So thanks to people like her, the mentors, or all over India and abroad, who thought out of the box, because as you know, at that point there was nobody else doing that kind of thing, and you had to just be creative and see whether can this be used for something like this. So they just kind of did that out of the box thinking, and for us at this point it was a little easier, of course. But I think at the same time, it is a little more difficult because now the patient is more demanding, and for a right reason. We need to give a bang-on result every single time. And for that, the technologies have started becoming better. So over time, during my training as well, there were a lot of refractive errors which couldn't be corrected at that point, which was getting experimented on, learned on. Can we do this for that? So I think in my training, what I've seen is that we are definitely getting closer to perfection. There is still a lot of scope to achieve that, but it made it definitely easier thanks to a lot of training courses that are being conducted all over. But yeah, the kind of machines that we have today have definitely made things easier.
Okay, so Dr. Shreya, so we see a number of patients that are informed/misinformed about refractive surgery, and there are multiple names for a similar type of procedure. So how do you deconfuse such a confused patient who comes to you?
So first of all, I usually tell them to, I request them to not look at Google because, Google doctor is always out to get you. So I usually urge them to, I urge them to ask as many questions as they want, to note it down, and, I'm happy to answer them. Just alleviate all the anxiety that is. So that's how I do it. And it's very, it is true. We often get patients who come and say, we want this particular technique.
Yeah.
not knowing what the surgery is all about. So then I like to sit and explain to them that, there are different kinds of methods of refractive surgery. Laser corneal vision is one of them, but there are, ways outside of that if the need should arise that, that's what you require. And so I also tell them that, we do this on a case-to-case basis. We do your scans, we do your testing in great detail, and then discuss options, of what works with you. It's not necessary that the best technology out there is necessarily best for you.
Right.
That's, I think, one of my favorite lines, which I tell most of my patients, but it is the
That's really
truth.
true.
It is the truth. Just because something is the best doesn't mean it's best for you. So that's how I usually start with.
So what you mean is that if there is a particular ABC type of technology which might be good for you, is
May
not
not
good
be
for.
good
Is that
for
true, ma'am?
May not. It may not.
Absolutely
Yeah,
true.
Yeah, because
So
every
there's
eye
no
is
one
different.
best technology. All the technologies have their best patients in which they
Yes.
can work the best.
Yes.
Oh, so basically, if a patient does, there are patients who come in with saying, "I want this technology only." So, would you go with what the patient is saying, or would you take a call yourself? How do you?
I would want to take the call myself, but sometimes the patients are not satisfied with the call you take, and then I let them go because ultimately I want to be the one in the driving seat.
Okay, so
Because we would think the best for the patient.
yes, ma'am.
If you ask me, Raghav, when we started, the doctor knew more than the patient. Now the patient feels that they know more than the doctor.
Feels is the word.
Feels
but
is the word,
but
yes.
still the doctor knows more than the patient.
Yeah, because even if I am going to a doctor, of course, a non-ophthalmologist, if I have any ailment, I would want the doctor to steer me through the disease and probably how to manage it and what the complications are. Similarly, I think yes, eyes are very, very sensitive, and we are of course playing with nature's gift. So yes, if that is done, it should be done in safe hands.